Come in.
Hello, my name is Sarah. I'm your nurse today, and I'm here to give you some medications. Can you tell me your name and your date of birth? My name is James Wilson. Date of birth is 5/12/1952. Checks out with the MAR. Checks out with the wristband. Okay, perfect. I'm gonna close the curtain and wash my hands. Kind of explain more in depth what I'm going to be doing. So today I'm going to be giving you your oral medications, and I'm going to be giving you two shots. One is your insulin, one is your flu vaccine. Right off the bat, do you have any questions?
No, I'm good.
Awesome. Okay. So then my third med check I'm doing right now, making sure I have everything I need. I'm checking the backs of the labels. Captopril 25 milligrams, perfect. Hydrochlorothiazide 50 milligrams. And then I've got my insulin, yep, and then my flu vaccine, everything's squared away. And then because captopril is an ACE inhibitor, I would be checking blood pressure immediately before administering. I'm going to give the oral meds first. So, let's get gloves on, because those are important too. Alrighty, Mr. Wilson, I'm going to be giving you your pills first. You have two pills. One is your hydrochlorot, which is your diuretic. That helps lower your blood pressure by pulling water and electrolytes out of your system. Come on. It pulls water and electrolytes out of your system. You will have to urinate more frequently. That's normal. Do you have any questions right away?
Nope, I'm good.
Cool. Good to know. Do you want to take your meds together in the same cup or separate cups? You said together, so I can put them all in the same cup. I know which one is the captopril, so I did the blood pressure, got my hydrochlorothiazide. For sake of saving plastic, we're going to pop this into the cup and leave it in the container. I've got my captopril. This is your ACE inhibitor. This also helps lower your blood pressure, and we're going to keep a close eye on your blood glucose because your this medication can interact and cause high blood sugar. Do you have any questions on that one? No? Awesome. I'd be acting a lot more professional right now. So I've got my medications in the cup, got my little cup of water, and I'm going to assist. So Mr. Wilson, I'm going to give you your pills now. He has them in a little bit of water. You say, ah, for me. I checked, the pills are not in his mouth, nothing's dropped on the floor, he has taken them. I'm going to discard of the water cup, but for right now I'm just going to leave it right there. And next I'm going to be doing the insulin. So first, I'm going to pick my site, making sure I'm not picking the same one that was done earlier. And I'm going to choose the stomach for now. And then I'm going to check, only exposing as much as I need to. I'm going to check for any irritation or anything like that, make sure it's all squared away. And then I'm going to clean, starting from the inside, going out 2 inches and always staying 2 inches away from the belly button. And I'm going to transfer over to the foam pad to do the actual injection. And I'll move these as well. So then I'm going to start again, cleaning from the inside out for at least 10 to 15 seconds and let it air dry. Now, when drying up the insulin, I have checked with the nurse beforehand to ensure that I'm giving 22 units. I'm giving 15 units of NPH, and then regular insulin 5 units, but then because his blood sugar was 169, I'm giving 2 extra units for sliding scale to account for higher blood glucose. And now, I wouldn't fan it, but I'm just making sure it's dry. I'm going to take off the cap straight out because this is sub-Q. I'm gonna make sure the bevel's up. I'm gonna pinch an inch, going at a 45-degree angle. You're gonna feel a slight pinch, Mr. Wilson. Go straight in and push down at a rate of 1 milliliter per 10 seconds. So take about 3 to 5 seconds to put that in. Pull it out. Put all the meds there and immediately put it in the sharps container and discard the cap. Are you still doing okay, Mr. Wilson?
Yes.
Yes, okay. No burning or itching or anything like that?
Nope.
Perfect. Okay, now we're gonna do your flu vaccine. I'm just cleaning up as I go. So we are going to do same thing. I'm gonna cover up your stomach, and since he's not on a blood thinner, I am not super worried about bleeding right now, but I would take the gauze sponge and put it on there for about 10 seconds, giving pressure, and I would stick a Band-Aid on there after if it was still bleeding. Now I'm going to go on the deltoid for your flu shot. I'm gonna find the acromion process up here. I'll demonstrate on this shoulder so it's easier to see. Find the acromion process up here. Go 2 fingers down, right in this triangular area. And I would clean that, starting in the center, going out 2 inches. I'm gonna move over to the fat pad again. So then, starting in the center, going out 2 inches, and letting it air dry. Now I'm double checking the flu vaccine again against my MAR, making sure I have everything on there, the date, the time, the dose, the medication, and the patient, making sure I have all the rights. Time, dose, medication, route, patient, and documentation. And now making sure that the safety is all the way back, taking the cap straight out. I'm gonna hold down the arm, and I'm gonna go in at a 90-degree angle with my needle, going in over halfway, and I'm gonna stabilize here. I'm gonna aspirate, there's no blood, and then I'm gonna inject for 3 to 5 seconds, pushing slowly on the plunger. And immediately put that safety on, wait for the click, and put it in the sharps. Grab that gauze again, and put it on there, hold it down for 10 to 15 seconds. And then if there's still bleeding after that, I will give a Band-Aid. Now, Mr. Wilson, something with the flu shot is it will be sore for a little while. I want you to keep an eye out for any allergic reactions or anything like that, like if it becomes extra red, if it's itchy, if it's extra painful or swollen. It is normal for your shoulder to hurt for a while after. Just try and keep moving it around so the medication can get distributed. Taking care of my gloves, throwing away all my extra supplies. Now I'm gonna document. I am putting my initials here to make sure that people know I am the one that gave the meds. So then what I'm doing is I am saying I gave the hydrochloride at 8 o'clock in the morning by mouth, and then captopril, same deal, 25 milligrams by mouth tablet, and also making sure to write blood pressure, which was within the normal range, so we don't need to worry about that. And I'll make a note of that over here. It's the same as it was earlier, 144/86. Then, going down the list, insulin 22 units, specifying 15 NPH and 7 regular, 5 usual, and then 2 for sliding scale accommodation. And then my flu vaccine, and I would say that I put the insulin in the stomach and the flu vaccine in the deltoid. And then make sure everything has been signed off. All right, Mr. Wilson, do you have any questions at all?
Nope.
Okay, good. I'll be back in about 15 to 30 minutes, check in on you and make sure you're still holding up all right. I'm gonna make sure, since he's in a wheelchair, make sure the wheels are locked. If he was in bed, I make sure the bed rails are up if I took them down. I'll give him his call light, make sure he has access to that. The wheels are locked, the bed is in the lowest position. Make sure he's comfortable, he has a blanket on or whatever is needed. I'm gonna wash my hands. Thank you so much for allowing me to work with you, Mr. Wilson. I will be back in 15 to 30 minutes to check in on you. Grab all of my supplies, open the curtain, and leave the room and make sure all of my stuff is documented in the system.